Hello, Dr. G here from naturalfoods.org. Do you know there's a procedure with the potential to eliminate chronic pain for many people? The problem is most physicians, even pain specialists, don't know anything about it. Research has shown that chronic pain is often caused by neuropathic pain. What that means is that the nerves themselves are generating the pain signals and at the same time can generate inflammation into the tissues that they innervate. So in other words, if your knee hurts, the source of the pain may not be the joint itself, like the cartilage and the ligaments and the tendons, but the sensory nerves around the joint. For an example, I often get patients that have had a total knee replacement, and they got the replacement because they had chronic pain from a degenerated joint. This is a very common procedure these days. The people come to me because their knee still hurts after having the surgery. The orthopedic doctor tells them that their joint is fine. It's not loose, it's not broken, and there's nothing that they can do for the pain. So they're placed on drugs or they just have to tough it out. Now with a careful examination, I can palpate the affected nerves. They actually course over the surface of the muscles. These nerves are swollen and tender to touch. Dr. Lifkoff found that if you inject over these painful nerves with dextrose, which is simple sugar, that the swelling and the pain goes away. And you can do a series of these injections and completely eliminate the pain in a course of 5 to 6 weeks. Now I went through Dr. Lifkoff's training for this procedure, and he calls it neural prolotherapy or neural regenerative therapy. I've done this treatment on numerous patients post-total knee replacement and on hundreds of other patients with all kinds of pain, literally from the top of the head to the bottom of the feet. I've saved many patients from having to have surgery or to take powerful drugs with painful side effects. I've treated conditions like Morton's neuroma, carpal tunnel syndrome, TMJ pain, shoulder pain, migraine, headaches, you name it. Pain of the spine, the neck, and the back. Now because this treatment is so effective, I'm doing 5 of these procedures per day at least. And it comes from all word of mouth recommendations from other patients that have had success with the therapy. I don't advertise. Now more recently, Dr. Lifkoff discovered that mannitol has some advantages over dextrose. And mannitol is now what I use when I inject. It's very safe, it's not metabolized in the body, doesn't affect the blood sugar or diabetes or any other medical condition that I've ever seen. This has got to be one of the safest procedures a doctor could possibly do. Now among the 600 or so doctors worldwide that perform this procedure, the only adverse reaction that's been found is a skin or subcutaneous infection that's estimated to occur in about 1 of every 300,000 injections. Now think about all the side effects of steroids that are being injected constantly, and there's no evidence that they help. Now can you imagine this? What if all physicians knew about this simple, safe technique? Yet this procedure remains unknown by most pain specialists and certainly by general practitioners. Now I'm here to get the word out about this amazing treatment. Find a specialist that's been trained by Dr. Lifkoff or one of his students. Now the treatment obviously doesn't cure every type of pain, but it often cures chronic neuropathic pain, which is one of the leading causes of chronic pain overall. Now an excellent physician will perform a history and a physical examination which will determine if you're a candidate for this treatment. A trial of injections is nearly 100% sensitive and specific for neuropathic pain if these mannitol perineural shots relieve your pain right away. This means you won't be wasting your time with the 5 weeks of injections if you don't respond with the initial growth, because it will relieve your pain if you have neuropathic pain. Now if you're one of those people that's extremely needle phobic, I've got some good news. You can try to do this treatment topically. You can put mannitol, and we usually add vitamin D and some kind of carrier gel or cream that you can apply topically to the painful area, and this can work as well, although the shots are more aggressive. Now there is one caveat. A lot of times there's an underlying cause for the vicious cycle of pain and inflammation. And you must address that, of course, if you don't want the pain to return. Now, these causes are rampant in our culture, so you really need to get to the root cause. This is a great treatment, and a lot of times the root cause is an injury or an overuse, so this treatment can completely cure the situation. But in those instances where a patient has a faulty lifestyle of something toxic in their lives, then you need to address that along with these treatments. This is Dr. G. Thanks so much for watching.